Christy from CHR Warrior Christy's Instagram and YouTube channel. I wanted to talk to y'all today about my VP Shunt. It's a ventriculoperitoneal shunt. Y'all may wonder, how does it work? Well, it works by taking fluid from the ventricles, in your brain, and it moves it down into the abdomen where it is absorbed into the body. By it doing that, it lowers the pressure and swelling of the brain, and it doesn't expand. There are 3 types of shunts. One is a VP shunt, where it is in the brain and then goes down to the stomach area. The second one is a VA, where it once again goes in the brain down into the heart. And the last one, or the third one, is an LP, which is from the shunt ventricle down into the lung. The surgical procedure that is done is known as a shunting surgery, and it's primarily to treat hydrocephalus in all types of patients from young to old. You can develop it at birth, or you can develop it later in life when you're elderly. Shunt surgery usually lasts from anywhere from an hour to 2 hours. When you first go into surgery, they reassure you, that everything is you're in good hands, that that you're safe. And then when you come out of surgery, you have to wake up from the anesthesia. If you're having severe pain, they give you medicine for it. As to the procedure, when you're having a shunting procedure done, from what I've been told previously by my 2 awesome neurosurgeons, is basically they shave an area of your head off, and if not a certain area, they shave all of it off, and they cut an incision. I don't know I can't remember if they said they drill into the head or not. I don't really remember. Sorry. And then they try to relieve and get some of the cerebral fluid out. And once that is done, they stick the tubing, which is this, basically, down, and they work it to go under your skin, either side, and then they put it either in the abdomen, the lung, or the heart, which they can't just try and work this through, because you have muscles, you have fat, everything like that. So they actually, from what I was told, they actually put a metal, I guess best way to put it would be metal rod down there, from your head down your neck area, down the chest cavity to at least probably to like right here, and they put it down, and then they're able to work it in. And then once they get past this area, they make either an incision in the lung or the chest area, or the abdomen, and they have to find the tubing, obviously. Then they pull it through basically, and they stick it into a piece of either your lung, your heart, or your abdomen area to where it can drain basically. How much does shunt surgery cost? It costs roughly around $2.7 million per shunt placement. And when you have to have a shunt placed, there is no replacing the tubing. There is no just placing the valve. They have to replace the whole shunt, because over time it could break or it could malfunction. So they would rather just replace all of it instead of just a part. You may wonder, where is it placed? Where is it in the body? Depending on what type of shunt you have, I personally have a VP Shunt right now. There is a long plastic tubing that goes into my brain ventricle, and then there is plastic right here with metal that you control by a magnet, and it's placed along the skull, and it goes down the ear, down my neck, across the cavity, and into my stomach area. You may be wondering, what happens when a malfunction occurs? Well, it varies in different cases with different patients. Symptoms start developing, and they can develop more rapidly. And if they do not treat it in time, or if they don't treat it within a few days or hours, it could lead to the person going into a coma, to potentially dying. And it is a crucial surgery. It is a much needed surgery, and it is very crucial to that person or to that patient to have a shunt revision, shunt surgery done, because it could be it's a matter of life and death. And that is not something to put off. You may wonder, what happens if I get sick? What happens if I get extremely sick to where I can no longer do stuff, to where my family knows I'm severely sick? So basically what you need to do is you need to be taken to the ER immediately. They will determine what testing needs to be done, and depending on the hospital, if they're not equipped, if they don't have the equipment to have the testing done, they usually will have a transport to come get you, to take you to a bigger hospital. That usually will. And there, your doctor, your shunt team, and your neurosurgeon, they will have testing done. They will have an MRI, CAT scan, X-ray done, and they will determine if your sickness is caused by anything else, like a virus or an infection. If you have an infection in your shunt tubing, and that goes down here and in the very top of the shunt, it can cause you to get sick very fast, very rapidly. And if you do not if your family or yourself and you notice it, don't take care of it fast, you will ultimately get sick, go into a coma, and die. And if your shunt team will know what's best for you and your case. Your shunt team will know what precautions need to be taken, what x-rays or imaging needs to happen. They will automatically know, and once they know that, they will either give you medicine to help fight the infection, or in some cases, like mine, when I got my infection 2 or 3 years ago now, they basically, what they did was they made a small incision, and they'll make, in my case, they made a small incision and they inserted a tubing, and they had a bag hooked up to an IV pole, and it was draining the infected CF fluid out of my head, out of my brain, and that's basically what they will do. And once most of it is clear and they think you're good enough to go into surgery, they will take you in and have the whole shunt removed and replaced. And depending on how your body handles that new shunt, and if you're still experiencing infected cerebral fluid, they may take it out, and if that happens, they will just continue draining it until they know all of it is out of your system. They will do that, and then they will also give you antibiotics in your IV to help fight the infection. So once it does clear, they can take you into surgery. They can fix your shunt, basically. Am I able to have imaging done, such as x-rays and MRIs? Well, if you're having an x-ray done of your shunt, it is called a shunt series. Those are fine. Those won't cause any potential damage to your shunt. As for an MRI, you need to talk with your neurosurgeon who placed the shunt, because if your shunt is programmable, like mine, you need to talk to him about precautions, because if it is programmable, there are magnets in the MRI machine that can set the dial or change the dial to a really low setting or to a really high setting, and it can ultimately make you very sick. And it's not right after you usually have an MRI done, you have to go to your neurologist's office to have them readjust your shunt, because it can cause, if you don't have it readjusted and or put back to the setting it was at, it can ultimately cause you to get sick and have symptoms of the shunt not working. And it could just be at a very low setting, which it can still make you sick, or it can be at a really high setting, which will make you sick also. But if it's at a really low setting, that means basically it is not draining the fluid. It'll ultimately cause headaches and pain in the frontal area and in the back. And if it is over draining, which means if the setting is too high, it can cause you to feel sick, nauseated. You can still have headaches with it, but basically you will be having to in my case with it, I've had it overdrain a couple of times, and you'll be able to tell because you'll be running to the bathroom to urinate about every 5, 10, 15 minutes, or even 20 minutes actually. And it kind of sucks, honestly. It's just not it's a good thing to have it readjusted. And in the same case with it under draining, you can still frequently be going to the bathroom as well. But in that case, it's not more of urinating, it's more of throwing up, it's more of throwing up mucus, throwing up, vomit. And it's very crucial to get seen by your shunt team, because at any point, if you don't have it adjusted, like I previously stated, with it under draining, it could eventually cause you to get very sick, and it could lead you to getting sick and then possibly going into a coma and dying, because it's not really draining at all. And so the cerebral fluid is back in the brain again, and your ventricles will be full. They'll be able to tell with a scan of it, and they'll be able to see if your ventricles are clear or if they're not. I will show y'all a picture of what clear ventricles look like and what ventricles look like when they're not clear. It's either on this side or this side. So that is what ventricles look like when they're clear and when they're not clear. In my case, with my hydrocephalus, I've experienced ventricles where they are clear and where they're not clear, and malfunctions. I've experienced infections. I've experienced just about everything, honestly. What happens if there is a blockage? Now, a blockage in a VP shunt and VA and LP, it varies. With the VP shunt like I have, it could be blocked because you're constipated. And with hydrocephalus, it can constipate you a lot, and it can ultimately put pressure on the end of the shunt that's in the stomach area, and it could stop it from working, which results in shunt surgery. A VA, you get, for the part, it is very, very risky, because with a blockage there, it means the buildup could either not be drained as fast, or there could be a blood clot. And an LP blockage, it entails basically a blood clot also, but if it is not drained properly, and if it is not drained, then it could ultimately put blockage, because there is so much fluid in that lung, and it could stop it from working, which all three result in shunt revisions. My experience with the VP shunts and all the malfunctions that I've had, the blockages and the infection, they all have taken a toll on me. I've had, I want to say maybe 4 or 5 blockages because I was constipated. I've only had 1 infection. I had meningitis, I believe. I don't know if it was meningitis or measles. I think it was meningitis. And then I've had just shunts stop working completely. I've had shunts break in 6 different places. I've had a lot happen, and I have a great shunt team. One of my past shunt doctors who I had, who is no longer with us, he performed my surgeries from when I want to say about 12 when he performed the first one, or second one I should say, and that one broke. That was the one that broke in 6 different places. I spent about a week in the hospital, and I was out of school. No one notified any of my teachers, and so they thought I went on vacation or something. And when I came back, I was like, oh no, I had surgery. Oh really? So it was funny. And then he saw me until I was 12, till I was 17, and then when I became the age of 18, he could no longer see me, so he referred me to this new doctor I have, Ramsey Assure. My first one was Dr. Timothy George, and then the second neurosurgeon that I've had, his name is Ramsey Assure. I've had him for about 18, now I'm 25. I've had quite a bit of surgeries with him, a lot more than I can really remember. I think I want to say 11 surgeries I've had with him. He's an amazing doctor. He taught me how to look for signs, how my family to look for signs if I show signs of shunt blockage or an infection. He treated me when I got a shunt infection. I got very, very sick. I won't really go into too much detail because it's a TMI moment and I don't want to gross anyone out. But I got very, very sick, and my mom and my aunt decided, you know what, she's not getting any better. They tried Pedialyte, Pediasure, they tried just about everything, and I wasn't getting better. So they took me to the hospital, and they couldn't do anything for me at the hospital, local hospital that I was at, because it was too much of a small facility. So they transferred me to a bigger one, and to the bigger one in Austin. The small one that I attended was in Luling, Texas, and they couldn't really do much for me there. I mean, all they could do was do an x-ray. They couldn't do too much, so they transferred me to Austin. Austin is where I got my MRI, my CAT scan, and all that. And they realized, okay, something's not right. And my mom told them my symptoms and everything. So what they did was they did all the imaging, the MRI, CAT scan. shunt series, and it didn't really, from what I understand, it didn't look like too much. It didn't really tell them all that much, so they had to, well, I don't think it's called a shunt tap. It's where they numb an area where the shunt is, the shunt tubing, and they stick a needle in where the tubing is at the very top in the ventricles, and that's where they tested it, and it came back that I had an infection. I want to say it was meningitis. That was the infection. And so I spent, well, actually I really don't know how long I spent there because I don't have any really memory of it. I don't remember getting sick. I don't remember how long I had been there. But from what my mom's told me, they basically did about 5 surgeries before before the last one took, and I was able to stay with the shunt and go into recovery. The downside of that infection, besides for the brain fogs after I woke up and not knowing where I was, when they brought me my food tray, I couldn't open my mouth more than an inch. I couldn't really hold my utensils, and I was having trouble with my vision. I was having trouble with my hearing. And when I got up to go to the bathroom, I couldn't really walk. I was having a lot of trouble with that. So I had to get help from my mother or from one of my nurses to help me. And to me, I know I should be happy and that I had that help, but to me, I just felt, at that time, I felt really discouraged. I felt like, well, why would I have this bad side effect from the surgery? And I didn't understand it. I didn't understand why this was happening, why God was letting this happen. Over the course of the next couple of days, a chaplain came and talked to me. He had me sign my power of attorney. He had me think about doing a will, a living testament, and just funeral arrangements, which I thought was very weird for a chaplain to do. But I guess that's how every hospital does it now, when a person experiences near death. And so, I mean, I understand. But once I was able to go home, I had to first prove that I could walk on my own. So I had to undergo physical therapy, which was hard. I got frustrated. They asked me a bunch of questions. They had me talk to them, repeat words. They had me do that. And then they asked, does your house have stairs? It's like, yeah, like 2 or 3. And so they had me practice going up and down stairs, which was hard. I could kind of go up them, but I couldn't really pick my feet up. So sometimes I would fall, and it would hurt. But of course, that nurse was there to help me. Going down the stairs was also hard because I couldn't, like I said before, I was having trouble with my vision, so I couldn't really see where it ended and then where a new step started, because it just wasn't clicking to me at that time. And after that happened, after I was sent home, everything, about a couple months later, my shunt malfunctioned. I don't know if it was from a blockage. It definitely wasn't an infection, but I had to have it revised, and that's the current one that I have now. And this is my 12th shunt that I've had over the past 25 years. The very first one that they put at birth lasted me until I was about 12, and then in between 12 and 25 I've had several more. I've had like 11 surgeries. So I mean, each warrior is different. Each hydrocephalus warrior is different. Each of their stories is different. So I am very thankful for my life, for, you know, God blessing me, you know. I am an overcomer, so that I'm very thankful for. Hope you found this video helpful. If you have any questions, or if you're a hydrocephalus warrior yourself, drop them in the comment section and I'll be more than willing to help you. Or you can go to our Instagram pages. They'll be in the description as well. And you're more than welcome to write us and about your questions or concerns, or your wishes. Thank you. We'll catch y'all later.